Hello everyone, my name is Lamia Al-Hazzani. I work at the Saudi Patient Safety Center and I am part of the Choosing Wisely Saudi Arabia core team. And in this presentation, I'm going to talk about the barriers of implementing Choosing Wisely in your institution and how to overcome those barriers. And I would like to start by having an introduction about Choosing Wisely and how it started in Saudi Arabia. In this slide, it shows the organizational chart of Choosing Wisely. And as you can see, Choosing Wisely Saudi Arabia has a steering committee. And below that, we have the Choosing Wisely initiative leader and the core team. And we have two main tracks to implement this project or initiative on our country or in our country. The first part is the scientific committee. And this committee has a role in managing the scientific recommendation either for healthcare providers or for the patients. And we have the support of many entities related to this part. The other part is about Choosing Wisely projects management, which is mainly to manage the champions all over the kingdom. And we have regional champions and hospital champions. And those are the main steps for Choosing Wisely Saudi Arabia, which is building the Choosing Wisely recommendations and then publishing those recommendations, and the recommendations to be adopted by the champions. And then after the adoption, we as core team have to work with those champions to manage them and support them. And in this slide, we can see that we chose Australia, Canada, and USA as benchmarks to our healthcare system in Saudi Arabia. And why is that? Is because when identifying barriers and how to overcome those barriers, each healthcare system is different. And this is what I'm trying to show in the next slides. In this slide, we can see Australia's healthcare system combines public and private services. It offers universal public health insurance, which is Medicare, alongside private health services and insurance, emphasizing a balance of public and private healthcare. Over here, Canada's healthcare system is publicly funded and provides universal coverage to operate on a provincial and territorial level, governed by Canada Health Act, focusing on accessibility and public administration. On the other hand, USA healthcare system is a mix of public and private entities characterized by high spending. It's largely driven by private insurance and providers with significant government involvement through programs like Medicare or Medicaid. How about Saudi Arabia healthcare system? So Saudi Arabia healthcare system is a government funded, providing free healthcare to citizens and expats working in public sector. It's undergoing transformation to enhance efficiency and quality, shifting towards privatization and public-private partnerships. So we would like now to start identifying the key challenges that we want to focus on. The key challenges we are going to discuss the first part, which is globally, and the second part, which is in Saudi Arabia. And in this slide, we are going to talk about the most common challenges in the Choosing Wisely initiative worldwide, starting with patient engagement. Efforts to involve patients in decision-making about their medical care can be difficult. For example, in Canada, despite various strategies to reach patients, only a small percentage were aware of the campaign. And also resistance from medical societies. So in some cases, like Norway, there was initial resistance from medical societies to the discussion about past practices of overdiagnosing and overtreating patients. Moving on to cultural and systematic barriers. Each country faces unique challenges based on its healthcare infrastructure and cultural context. This necessitates localized solutions, which can make sharing lessons about implementation very difficult. Now, about measuring the impact, determining the effectiveness of the initiative, especially changes in physician and patient attitudes and behaviors, is complex and challenging. Moving to balancing flexibility with consistency, the initiative's flexibility allow for adoption to local contexts, but can also limit the ability to share effective strategies and measure impact consistently. Last but not least, educational changes in medical training, integrating principles of resource stewardship and appropriate care into medical education is a challenge requiring shift in both formal and informal curriculums. So, is it similar to the challenges in choosing wisely Saudi Arabia? Let's find out. And in this slide, we are going to talk about the Choosing Wisely Saudi Arabia challenges that was discussed in 2022 as an outcome of a workshop that was done in the presence of all the champions in Saudi Arabia from all over the kingdom. The first one was the lack of leadership support, and what we mean by the lack of leadership support are the leaders in the healthcare institution. And the second one was fear of social media influence by writing something in social media about this healthcare provider or this physician, saying that they did not provide them with the intervention they needed or something similar to that. And also no clear choosing wisely implementation guide was one of the challenges that was addressed by the champions. And the next one was the fear of 937 complaints, and 937 is the number for the call center that is in the Ministry of Health to receive all the calls from the patient, either for requests or for complaints or for even something else. And also patient visits time is very limited. So there is no time to explain to the patient why we chose this kind of intervention. And this takes us to the next point, which is patient resistance and lack of awareness that will happen in the clinic by patients saying, why didn't you do that? I need this intervention, or I need this medication, or I need this radiation request, and etc. And then fear of medical legal issues that the physician face or fear of, and lack of health care provider support. So if the champion is assigned or assigned in the hospital, they are facing a problem with lack of support from the healthcare providers or the physicians in following the recommendations they are providing for them. Last but not least is the lack of healthcare provider awareness about choosing wisely. So if the healthcare providers either allied medical professionals or even the physicians have no awareness of choosing wisely, so therefore they will not try to implement it in the hospital. And in this slide, the challenges changed in 2023. So they shifted to another kind of challenges because the core team worked on fixing some of the challenges that were in 2022. So the first one was the lack of recognition and incentives. So absence of tangible rewards and recognition for participation, because it is a voluntary work that is part of their daily work to become a champion. The second one is leadership commitment, which continued from 2022 to 2023. And then the impact measurement was a challenge because healthcare professionals or champions were not able to measure the impact of their work, or it was difficult for them to measure the impact of the interventions and the implementation of the recommendation. And also the physician commitment as a challenge continued from 2022 until 2023. And then free of charge treatment is a big issue that we face, because in Saudi Arabia, as we said, all or most of the healthcare institutions are funded by the government. So the patients use this statement as a way to discuss with the healthcare provider that the charge of the treatment is free and the interventions are free. So why aren't you providing this intervention or this medication or this service? And then fear of patient complaint also continued from 2022 to 2023. And also the last challenge was data collection challenges. Gathering pre and post implementation data for the Choosing Wisely initiative is a significant challenge. So how about the solutions? So as a core team, we worked on several solutions to help those champions to move on with their implementation or with their work in implementing Choosing Wisely recommendations. Choosing Wisely Saudi Arabia suggested solutions in 2022 was leadership engagement and appointment. So we started appointing leaders for Choosing Wisely in the region to have higher commitment. And also we came up with a solution for workshop targeting leaders. So we worked on engaging leaders and also providing them with workshops to understand Choosing Wisely as a concept and Choosing Wisely implementation steps. And also increase the awareness among patients and healthcare providers and the community about Choosing Wisely through campaigns that targets each audience differently. And also we engaged 937, which is the call center of MOH or Ministry of Health. We engaged them and we did an agreement to receive those complaints and deal with them, or how to deal with them. And also build national recommendations for champions to follow. So it was the recommendations that we used to follow in Saudi Arabia was to follow recommendations from international entities. But we started doing our own recommendation in collaboration with the scientific societies within the Kingdom of Saudi Arabia. And also establishing a unified assessment tool for all the champions to follow, so we can have a unified work in the kingdom. Last but not least is establishing implementation guideline, which was a very cornerstone to all the champions that are newly engaged in the campaign, or the ones that we are already having as champions. And in this slide, we are only showcasing the details of the solutions that we came up with. And also we grouped those solutions into three major groups, which are leadership and healthcare providers and patients, and also on system level. And in our last slide, we would like to say that in the diverse landscape of global healthcare, each country, institution, and healthcare champion faces unique challenges and opportunities. Recognizing and embracing this diversity is key to overcoming barriers and crafting tailored solutions. Your journey in the Choosing Wisely initiative is distinct. It requires identifying your specific challenges and creating bespoke solutions to effectively enhance patient care and medical practices in your unique context. Thank you very much, and hope you learned a lot from this presentation. See you.